So I'll begin by describing the basic logistics of this webinar. We're so delighted to have all of you with us today. We have some amazing panelists, and they have a wealth of expertise to share with you during this next hour. Each panelist will begin by giving a 2-minute introduction about themselves, their current role, and their greatest lesson learned related to responsible innovation and social entrepreneurship. And then we'll dedicate the remaining 45 minutes or so to your questions and answers. And we received many stellar questions already submitted from you, our audience, by Monday's question submission deadline. We selected the most common and most thoughtful questions to ask our panelists. And we also invite you to submit additional questions in the text box on the left of your webinar screen. And then we'll select those additional questions to ask the panelists today as well. Several of today's webinar registrants inquired about opportunities for students to become involved with responsible social entrepreneurship in developing countries. And for those who are interested in this type of opportunity, we especially encourage you to explore Unite for Sight's Global Impact Corps Volunteer Abroad program. Unite for Sight is the world's only organization that is a healthcare delivery organization that also offers immersive global health education and social entrepreneurship opportunities for both students and professionals. And participants support and learn from the local doctors in Ghana, Honduras, and India, as the local doctors provide care to patients living in extreme poverty in villages, slums, and refugee camps. Participants learn from those local medical professionals about patient barriers to care, effective strategies to reach the hardest to reach patients who are otherwise unable to access or afford care. And the local doctors are incredible social entrepreneurs who design very effective and innovative strategies to eliminate these barriers to care for those hardest to reach patients. So we have an incredible group of panelists today who will share their tremendous insights and expertise about responsible innovation and social entrepreneurship. They're all deeply involved in health, development, and social entrepreneurship and come from a range of backgrounds and interests. This webinar will explore the process of developing and implementing responsible, innovative ideas with a focus on ensuring quality, effective social entrepreneurship. We'll proceed now with having our panelists introduce themselves. And I'm delighted to introduce to you our first panelist, Elizabeth Johansson. Elizabeth, please begin by introducing yourself, your background and current role, and please also share your greatest lesson learned related to responsible innovation and social entrepreneurship.
Great. It's great to be here. So I'm Elizabeth Johansson, Director of Product Development at nonprofit Design That Matters. We specifically design products to help poor people in developing countries. My background is by way of engineering degree at Harvey Mudd College and 8 years at IDEO, a product design consultancy, before I came to Design That Matters 5 years ago. And our kind of one of the big insights working in this space is that whereas I used to work designing medical products in the United States, where there are existing roads, where there are trucks that can carry the products to the people, where there are warehouses to keep the products, where there are sales teams and networks already in place, the places where we're trying to work don't have that infrastructure already in place. So for us, one of the biggest insights is that we have to partner in order to do the work we do. No one organization can take on all of the challenges needed to bring a product all the way through impact. So I'd love to tell you more about that later.
Wonderful. Thank you so much, Elizabeth. Rich Limesmider, please introduce yourself as well.
Hi, everyone. This is Rich Limesmider. I'm the Vice President for Fellowship Programs at Echoing Green. And we are a 30-year-old organization that for all that time has been looking to identify the biggest and best very early stage ideas from social entrepreneurs anywhere in the world. And we give a little bit of money and hopefully a powerful community leadership development experiences to help emerging leaders see if the idea they have has legs. I think the biggest lesson that I've learned in reviewing literally 12 or 15,000 applications from social entrepreneurs over the past 5 years is how important it is that a social entrepreneur actually be focused on a particular social issue and problem or community as opposed to being focused on the notion of social entrepreneurship. So unlike in maybe the mainstream entrepreneurship community where it makes sense possibly to aspire to be an entrepreneur, my experience is that the best social entrepreneurs aren't actually interested in being social entrepreneurs. They're interested in solving a particular problem and have simply decided that social entrepreneurship is the best way for them to do that.
Wonderful. Thank you so much, Rich. And Jordan Levy, please introduce yourself as well.
Sure, thank you. My name is Jordan Levy, and I'm the Chief External Relations Officer at Ubuntu Education Fund. Ubuntu is based in Port Elizabeth, South Africa, and we take orphaned and vulnerable children, we say from cradle to career, and in saying that, what we do is truly go deep into the lives of these children, their families, and we're trying to rewrite the development narrative away from large number outputs and into impact that has to do with the transformation in a human being's life. And I think the lessons that I've learned in this vein is that in order for social entrepreneurship to be successful, you need the right balance of local leadership and understanding of context and access to assets that are often not available to those that are in smaller communities or that are truly local or community-led, and how to find that right balance and how to create access both ways.
Wonderful. Thank you so much. And Heather, if you can please introduce yourself as well.
Sure. Hello, I'm calling in from Nicaragua, so I hope the Skype connection holds. My name is Heather Zornitzer, and I am the Information and Communication Technologies for Health Program Director for a small nonprofit organization, the Sustainable Sciences Institute. My background, very briefly, is in biology from Reed College, and I also have a master's in international agricultural development and a background in public health with a Master of Public Health from UC Berkeley. I focus my work and research in Latin America on and off since 1998, and I've been involved with the e-health space with the Sustainable Sciences Institute since 2008 and based here permanently in Nicaragua since 2010. SSI is a small group formally incorporated about 16 years ago. We have offices in San Francisco, in Cairo, and here in Managua. And in one long sentence, we work on public health capacity building in limited resource settings. Specifically, we work with public health researchers, primary care, doctors, nurses, frontline health responders, community health workers, and also policymakers, donors, and research institutions to increase access to information and resources around public health research and applying that research into public health action and interventions. The program that I run is a bit of a more agile program within SSI, and we have a solutions laboratory here in Nicaragua where we work with eHealth and mHealth tools of different kinds in different ways for different kinds of priority diseases, always responding to partners' requests for support at either a technical level or a policy level around design phase, testing phase, implementation phase, and evaluation of different kinds of intervention rollouts and scale-ups. I think, in short, I would agree with all of the panelists so far about lessons learned in terms of context being key in finding balances between local leadership and international collaborators and input in different ways. I think in our case, one of our biggest lessons learned is to really focus on innovative kinds of collaborations, often so much of which are very non-traditional, to bring creative and fruitful innovation to fruition. So not developing hammers and looking for nails, but really taking into account local context, local resources, and local ingenuity when it comes to developing solutions to problems that can actually be exported to other parts of the world as well, and not just stay local.
Terrific. Thank you so much, Heather. And James, if you can also introduce yourself, please.
Hi, everyone. I'm James Nardella. I'm the Executive Director of the Lawala Community Alliance, which is an indigenously founded nonprofit health and development organization that's working exclusively in Western Kenya. and we are working to increase child survival, to reduce the burden of HIV, and to achieve gender equity in a rural population that has acute needs. So we run a community hospital with wraparound programs in education and economic empowerment, and we've grown to serve more than 20,000 people over the last 7 years. Our work has become known through the exposure that we've received. Apple did a short film about us last year. We've been featured on ABC World News, CNN, and in the documentary Sons of Lawala. And we work with a number of partners on the ground, including the Kenyan government, USAID, Johnson & Johnson, McDonald's, and other corporate funders. And we're in the U.S., we're closely affiliated with Vanderbilt University, which is where we have our offices. And I'm the executive director, which means I lead program strategy and have been working here since the launch of our organization at the startup phase. And I also work on business development, which is short for fundraising, bringing new organizations into the fold to support our work. And it's great to be on the phone. I would say that something I've learned a lot about as a social entrepreneur, I guess, is just not always believing that we have to start our own organizations in order to solve a problem. There's a lot of redundancy out there, and oftentimes when I'm working with students, I guest lecture here at Vanderbilt frequently, and students quickly jump to the need to start an organization of their own without always understanding the landscape of who is already working in the field, what's being accomplished, and how they might join the effort. And so instead we create redundancy. I would say where Lawala, as an organization, where we've learned what our unique fit is and how we're not being redundant, is just that we are a Kenyan-founded organization with a U.S. affiliation, not the other way around. Our co-founders are 2 Kenyan doctors. And then the second thing is we're working in a high-needs geography where there weren't any other NGO or government players at work when we started the organization in 2007. So we understood that we needed to not be redundant, but that's certainly something I've learned over time.
Terrific. Thank you so much. And Andrew, if you can please introduce yourself as well, our final panelist.
Yeah, so my name's Andrew Bentley. I'm thrilled to be a part of the call. I'm currently in New York City. I'm representing 2 organizations. About 6 years ago, I was part of a group that co-founded Global Health Corps, which is a nonprofit that mobilizes and trains young leaders in the movement for health equity. We're currently in 6 countries, mostly in Eastern Africa, and also have a pretty big domestic commitment here in the United States. We partner with great global health organizations such as Partners in Health, and here domestically, Boys and Girls Club, and jointly work on projects together. What we want to do is help nonprofits in terms of human capital fill certain gaps that they have. So one thing that we'll do is figure out what skill sets are needed for a current project and go out and recruit fellows to work on those projects for a 1-year commitment. We oftentimes recruit fellows with skill sets that are outside of the kind of general skill sets that our partner will have. So for instance, we've had fellows that have experience in architecture or in supply chain management, et cetera. I think one thing that makes our model a little unique is for each placement we have 2 fellows, one from the country that they're working in and one from another country. So we think that this really facilitates best practice sharing. It has all sorts of benefits from cultural awareness to emotional benefits and also practical benefits in the field. We grew from 22 fellows, and this year, 6th class is 128 fellows. So each year we're growing about 20 to 40% year on year. I'm also representing Google Fiber. I'm currently working at Google on our national community impact team, so working from on a social justice issue from the private sector. Google Fiber, for those of you who don't know, it's small. We're a startup business within Google. We work mostly to deliver residential high-speed internet and TV. So our fiber-based internet is about 100 times faster than your average broadband connection in the home. We're in 3 cities, Kansas City, Provo, Utah, and Austin, Texas. So my community impact team, our job is to figure out how Google can be a great corporate citizen in those 3 cities and the cities we're currently working on expanding in. The issue that I work on the most is digital inclusion. It's addressing the digital divide. I define it as digital inclusion as the process of building an environment where all people, especially those in underserved communities, have the resources to benefit from the internet. It's a little outside of the general kind of health context we're discussing right now, but I do think it's a hidden social justice issue that definitely affects all of the other issues we're going to talk about today. Right now, about 30% of American adults don't have internet in the home, and this affects income inequality, health information inequities, et cetera. So one thing I've learned, I would echo James, I think that's a great point about redundant models and organizations. I think, and that was going to be the one I had sketched down here. But I would also say something I've learned is that socialization process. So as a social entrepreneur, when you have a great idea, the process of bringing in advisors, doing interviews, and really researching how your model can change and what should change about it, I think that's critical in both the Global Health Corps work in the founding process, but also in the programs that I run at Google Fiber. So I think it's critical to approach that with a humble attitude and to really kind of set your pride aside and to change things when they come up and when feedback's given.
Terrific. Thank you so much, Andrew. And Carter Powers, if you can introduce yourself as well, who's our final of the 7 panelists.
Hi, this is Carter Powers. I'm the Chief Operations Officer at Demagi. Demagi is a social enterprise founded in 2002, and we specifically focus on mHealth technology solutions for frontline worker programs, or specifically community healthcare workers. So globally, we're about 90 staff members, and we have offices in 4 countries: India, South Africa, Senegal, Mozambique, and here in the U.S. And overall, our mobile technology solution is called ComCare, and we provide both the mobile side of the platform as well as a cloud-based platform. Overall, we try to support our users, which are frontline workers or community healthcare workers, and our clients end up being the programs that then support these frontline programs in international development and in global health. So our software is open source, and we provide sort of a turnkey cloud platform where you can build your own mobile applications and SMS tools. To date, we're one of the most widely used mHealth programs, and we've done over 268 projects in about 40 countries and have about 5,000 active community healthcare workers now. In terms of responsible innovation and the quality of social entrepreneurship, I think our biggest learning has really been patience and persistence and really understanding the problem that you're trying to solve. I think similar to some of the other panelists, when people talk about entrepreneurship, they think it's pretty tough. And being a social entrepreneur is even tougher than just being an entrepreneur. So I think what's really grounded us at Demagi is that we're a very mission-driven organization, and we really focus on making decisions around what makes the most impact, what provides the most team satisfaction, and then think about profit. So as a social enterprise, making decisions sort of based on our mission in that order has been really important to us.
Excellent. Thank you so much to all of our panelists for your terrific introductions. And now I'll proceed with the question and answer session. And these are questions that have been submitted in advance by our audience members. But again, if you have any additional questions, please submit those on the left side of your webinar screen. So we'll begin with Rich. What key factors does Echoing Green use to evaluate applications from budding social entrepreneurs?
Thanks, Jennifer. So this is a terrific question. We actually really try to think through 2 aspects of every social entrepreneur who comes sort of into our pipeline. Let me ask you, what's a good, do you think 2 or 3 minutes to think through the answer? Because we have a pretty comprehensive process that takes us a full year, but we probably don't have a year for me to speak on the call.
Yes, just a couple minutes sounds perfect.
Okay, great. So, for us, we're really focused on very early stage ideas and early stage entrepreneurs. So we have a number of criteria. We actually have a rubric with 8 criteria. 4 are relevant to the qualities of the person who's coming in the door, and 4 are relevant to the qualities of their idea, what they're trying to do in the world. But we are actually very, very clear that for us, the person absolutely trumps the idea. And we think that's probably true in general, but especially at the earliest stages. So even within those 4 qualities that are focused on the idea that a person is bringing in, what is the scale of potential impact? Is it an innovative idea? Is it actually important in the world? Only one of those 4, the last one, is to know a little bit about the business plan. So sort of the traditional, how much money is this going to cost? What would your staffing structure look like? What kind of product are you actually working on? Is only one of our 8 overall criteria, because in our nearly 30 years of experience, we know that for an early stage entrepreneur, the work that they will be doing 12 months in often bears almost no resemblance to what they were doing when we first met them. So we don't sweat the specific details, the financial statements, all that kind of stuff. We like to really focus our attention on the qualities of the person, which are about understanding their passion. Like I spoke about at the beginning, we want to know why someone cares deeply about making change in the world, because this is a hard business, and there will be hiccups and obstacles, and someone who's really connected to a community or really feels that sense of passion is going to be able to ride those things out. We look for qualities around leadership. We look for evidence and examples of resilience in a person's background and history. And then we look for something that we call resource magnetism. And that overlaps a little bit with what people think of as charisma, but it's really actually quite different than charisma. For us, resource magnetism is the quality of a person where, whether or not they're a great public speaker, whether or not they seem slick or poised, when a person walks into a room and then walks out an hour later with offers for volunteers, with someone has maybe written them a check or simply offered to help and support them in some way, we call that being a resource magnet. And so as we look for social entrepreneurs, and we get about 3,000 applications from 120 countries every year, we're really trying to find ways to understand the qualities of that person, and then to a lesser extent, the idea they're bringing in.
Terrific. Thank you so much, Rich. And Andrew, what are some promising practices in terms of marketing a social change idea without a product to sell and attracting corporate partners who are in line with a social justice agenda?
Yeah, so this is a great question. I'm going to probably derive a lot of my experience from Google Fiber on this one, but a little bit from Global Health Corps. So I think there's 2 things to think about. There's national partnerships with the private sector and also local ones. Thinking about national, I think the way I would start is trying to understand who out there has overlapping interests. And you can take many angles here, but I guess as an example for GHC, we have the health angle and finding national corporate partners that that had their business relevant to health, but also leadership and youth development, which is a little bit more broadly appealing. Corporations, private sector is much more likely to partner and work with you if it makes sense for their business and their goals, and fits within their issue expertise as well. I think you get much more passionate responses when you're working with people that understand the issue that you're addressing. I also think that there is a growing local trend. Locally, you can work with private sector organizations that are a little bit outside of their comfort zone when it comes to issues. And there's a really growing trend out there for businesses to affect the communities around them. I think one key thing I would bring up that's pretty universal, and I really look for at Google Fiber when we're looking for nonprofit partners, is partnership, and that was in the question. I think oftentimes in the private sector, we're sort of approached and the pitch is really, hey, write us a check. But, we really look for someone that we can partner with, whether it's on programming or, developing an idea, even if it's in just idea phase. That's when you can get people to really passionately respond to your social entrepreneurship idea. The other one is thinking about non-financial contributions. So at Google Fiber, we call this treasure, time, and talent. And treasure is sponsorship, but in financial grants, but it can also be products, right? So in-house products. Time can be volunteering of employees. or helping to build coalitions, and talent, it can be skills or knowledge. So oftentimes those are a lot easier for private sector organizations to give than just a grant or sponsorship. And it's something that can really get a good foot in the door and build a partnership that can lead to something more fruitful later on.
Wonderful. Thank you, Andrew. And Carter, there are so many global health technologies and mHealth solutions constantly being developed, but oftentimes they fail to achieve their stated missions, duplicating existing efforts, creating ineffectiveness in local communities, et cetera. How should entrepreneurs avoid reinventing the wheel, and how can they ensure quality?
Thanks, Jennifer. In general, it's a tough question, and I think it's part of working in global health, which can be challenging overall. And it comes back to what the previous panelist said, which is around the business model. Given the funding sources in global health, there's typically a lot of governments and international organizations and different consortiums. So overall, it can be pretty challenging to align the problem that you're trying to solve with the market that is asking for it, as well as something that is designed for scale. So often in global health, the sort of market-driven approach of a traditional business isn't necessarily well aligned with the value you're trying to create, which is part of the reason why we're all focused on solving these kind of social issues. But overall, it makes making a viable business model pretty tough, and there ends up being a lot of politics and sort of non-value-based decisions around the technology front. So there are tons of competitors and tons of other products out there in mobile health, and I think what Demagi's approach has been is really to focus on creating a product rather than developing a new solution and a custom solution every time a need comes up. So specifically, we think that having a cloud product that's sort of turnkey and allows people to build their applications on a common platform both helps them get started faster, but then also guarantees that we're going to sort of keep the lights on and keep the servers on and keep the technology going. So overall, it's a pretty crowded space, and people are no longer really innovating based on the best technology. Really, where the innovation is coming on the mobile technologies front is really around innovative business models and really how you go to market, and not just how you can create the solution one time, but how do you provide that as a sustainable system and support that over time.
Thank you, Carter. And Heather, do you have additional thoughts on this?
Thank you, Jennifer. Yeah, I think so. We work from at a slightly different place in this sector. We often work specifically around information and communication technologies and in the health space, although we've done a little bit of work with ag and some other sectors in development. But I think we work a bit further upstream. So we don't work directly with social entrepreneurs or business models per se. We're a nonprofit, and we hire out for our services, and so we're a bit removed from further downstream from business development around these issues. But in terms of innovating and in terms of not duplicating efforts and making sure that you have quality products and things that are the right fit, and I think Demagi is a great example of this, and we've worked with Demagi in the past, so it's great to be on this panel with Carter. But I think, the approach that you try to come up with products that solve real problems. So you don't want to be looking for imagined needs. You don't want to be looking for things that, have been designed in a boardroom, whether it's in the global north or the global south. Tools that are going to solve real-world problems need to be designed and tested in the real world within those contexts. And this can get macro or micro. You can get down to a community level for a single app that's a game to get people to report where mosquito larvae are, hanging out for dengue prevention, or you can go all the way up to the national level health information systems. It really depends on the scale and scope of what you want to do. I think on a technical level and sort of on a project management approach and sort of a design approach, in general, to make sure that things that you're working with are going to be useful, that you're designing, depending on the sector. In health, there are some very specific standards that need to be met. And unfortunately, there's been a lot of sort of parachute design approaches to solving certain problems, but for example, things that don't necessarily take into account patient confidentiality or standards for interoperability of tools as information gets moved between different actors and different systems and sectors. And in a health system. So I think, making sure that you know your landscape before you enter into a context trying to propose a solution, I think is really critical, whether or not there are policies in place that allow certain things to be used in accordance with national laws or otherwise. I think, in general, as everybody said, but I think specifically around innovations and responsibly innovating and reducing redundancy is making sure that you have human resources that understand some of the more complex issues around the game of social enterprise funding to some extent. So, hackathons and innovation challenges and other things that would kind of spark innovation cycles at a local level are great, but those, in addition to just getting new ideas and new potential solutions proposed, those people need to figure out and have access to understanding that this is a game. As Carter said, and I think as others have mentioned, there's a subtlety around funding interests and meeting high numbers for development impact and the rest of it, and we can talk a bit about impact evaluation maybe later on, but I think people that are working in this space need to understand what it's going to take to push these things through, and not just the sexy apps that are going to catch certain attentions here and there, but to really think about the life cycle of innovation for impact.
Thank you so much. And Elizabeth, what do you think is necessary to improve the quality, effectiveness, and longevity of technology and mHealth solutions in global health?
Hi. Well, I spoke earlier in my introduction about partnerships. Most recently at Design That Matters, we've created a device called Firefly, which is a phototherapy device to treat newborns with jaundice. And essentially 10% of all newborns worldwide need treatment for jaundice. It's something that not many of us think about here in the U.S. because often it's just so easy to treat and it's caught so early that it just becomes second nature. We hardly think about it at all. But abroad, nearly 5% of newborn mortality is thought to be caused by untreated jaundice. And the amazing thing about it is you only shine blue light on the skin in order to make it happen. So when we kind of looked at existing global health technology, especially what we call phototherapy lamps used to create and treat the jaundice, one of the things we noticed is that people were donating most often existing technology, either buying new technology or refurbishing old technology from the States and then sending it abroad. And one of the difficult things we saw when we would visit a lot of the hospitals with some of the partners that we work with, that much of this technology quickly breaks. We essentially, through the process of doing a lot of field research hosted by partners who know their local communities really well, we were able to come up with 5 what we call typical misfits for medical technology in developing countries. And they range from the equipment not being maintainable because there aren't trained technicians to fix it there aren't replacement parts locally available, and even if you have the money, a lot of the international companies won't sell you replacement parts. So ranging from that all the way to just trust in the equipment. A lot of the equipment that's donated abroad is either way too intimidating for local healthcare workers to actually put it into use, and so we often saw equipment under drape, really new and nice-looking equipment, but that had obviously never been used. Or on the other end, it's refurbished and kind of so dinged and beaten up, people don't trust that it's going to do the job because they know what a real professional and modern piece of medical equipment looks like. So when thinking about how do we improve this situation, what was really important to us is to create partnerships where we were able to use and sort of bring the best technology and design to bear on the problem, but make sure that it was going to be something that was going to be locally accepted. And in the Firefly design process, I think a lot of, in global health and kind of equipment design, there's a lot of work on affordability and the assumption that the reason a lot of the equipment isn't present or isn't working is because it's not affordable. But one of the things we saw when we went in was that beyond affordability, it was a lot about that trust. and especially about creating a simple design that health workers with little training could easily use, felt confident in using, and also helped extend the care down to the local level instead of requiring everyone to transfer to the national hospital in order to get care. So for us, I think one of the big keys to improving that quality and effectiveness of solutions in global health is about that partnership to really understand the local needs, the local perspectives, so that whatever you're designing ends up hitting the mark.
Terrific. Thank you, Elizabeth. And James, how do you ensure a focus on the input and experience of the local communities that you are working to support?
That's a great question. We're working in Lawala at the grassroots level as a direct service provider. So we have 160 Kenyans employed by our project, 90 of whom are there full-time and 70 part-time. And we really pride ourselves in community participation in our work. And three things that we look for in terms of participation are planning, implementing, and evaluating together with the community. So let me use an example. I think it's a little more tangible if I talk about a real project. So we do water and sanitation and hygiene programs at 13 area schools. And before we enact any WASH program, we work with a school committee that's a focus group of parents, school management, and students, and we ask them to help us create a water and sanitation and hygiene plan for the school. And if it takes 2 weeks for that plan to come about or 6 months, it doesn't matter to us. We'll stick with them and help them create a plan for the school. And we use what we call a resource ladder, which is listing those things which are most expensive and those things which are least expensive, and talking with the community about which parts they might handle on their own. So for instance, maybe a school has an existing rain catchment tank that's only 500 liters, which is quite small and will never supply the school. And it's got a broken tap and maybe some missing gutters. Well, that's a low resource thing for the school to work on because really it involves setting up rules and regulations, training parents and school leaders on the importance of taking care of the water, and then maybe replacing a tap and some gutters. Where something like the construction of a large rain catchment, maybe a 10,000 liter tank, would require external resources and some technical support. And so the schools create this, using their resource ladder, they create a school WASH plan, a water and sanitation and hygiene plan. And our staff, their job is simply to go out and track with the school on their progress on the plan. And one important thing on the plan is the schools tell us when we have to participate. So for instance, maybe the first 4 or 5 steps might be just sensitization of the teachers and the pupils about the use of the water at the school. Maybe it's setting up tippy taps, which are low resource hand washing devices, really inexpensive things. And then when it comes to maybe construction of latrines or the rain catchment tanks, they notify us that it's our turn to contribute. So in this way, we're implementing together. And then as we look back at that plan and judge whether we've been successful, whether we've actually led the school in increasing the health behavior of the students, we evaluate the project together as a team. And one of the challenges with that is just that not all funders really will put their money behind projects that plan, implement, and evaluate with the community. So often you have to argue your case that, look, this school A, let's say in our case a school named Uriri, was behind on their planning. And we said, they're going to come through on this project, but it might be about 8 months behind. Will you stick with us? Maybe we'll pass them up, pick up another school, and include them in the planning and implementation steps. And we'll track back with Uriri over time and being able to defend that planning, implementation, and evaluation process even to external donors as it's needed.
Wonderful. Thank you, James. And Jordan, in the communities where you work, has the increasing presence and use of social media outlets played a role in promoting or dispelling any cultural myths, misunderstandings, or socially stigmatized behaviors and attitudes?
Yes, well, actually I think it probably has played a role. but I don't know how significant it is. And the reason for this is I've lived in South Africa for the last 10 years and worked in this community and seen what it takes to truly promote behavior change. So if we're talking about true behavior change in any of our lives, this type of thing doesn't happen overnight. Whether or not we know eating something or smoking something or drinking something is bad for our health, for example, we don't just change it because somebody tweets about it or we see it on Facebook. True behavior change, like almost any intervention, and pretty much all of the panelists so far have touched on the depth of interventions that are needed, is significant. There is a real depth needed when you're looking at somebody's life and how they go about looking at the world. And I think the same thing is true of deep-seated perceptions. I certainly think in the 10 years that I've been in South Africa, and certainly the 15 years that Ubuntu Education Fund has been working on the ground, stigma has changed. And, for example, if we're talking about HIV and AIDS, the ability to talk about the virus, the ability to have conversations about it, certainly has changed. But this is not from one factor or another. It's from a combination of multiple different things that have gone on over the last few decades to relieve that stigma, for example. And then as far as behaviors, if we're talking about sexual behaviors, if we're talking about dangerous behaviors, those things do change in different generations. Those things do change with intense interventions. But we find that, for example, in-depth counseling or ongoing support of a family where you truly get to know the person that you're working with and that the community itself is involved and neighbors can talk to neighbors and people who truly understand the social fabric of what's going on can make a difference. And this could happen possibly being social media as one of those avenues in which people communicate. Certainly the young people that I interact with do use certain types of social media in South Africa. That's WhatsApp more than anything else. And certainly positive messaging or negative messaging can go on those social media outlets, and I'm sure it has an influence. But in trying to answer your question, what I'm saying is that it can't be overestimated, as it is certainly one factor amongst many, and any change that goes on that I've seen over the last 10, 15 years has to do with in-depth interventions, in-depth changes in society, multiple level of relationship interaction.
Excellent. Thank you, Jordan. And Elizabeth, how do you incorporate locally developed ideas and cultural appropriateness into product design?
Thank you. This process for us is an iterative one. Our headquarters are in Salem, Massachusetts, and we leverage a lot of resources around Salem in order to get great ideas. But in order to get great ideas that will serve someone in another culture, in another country, we really need to tap into what people are thinking and doing and feeling abroad. And so we use a variety of techniques that fall under the lens of what we call human-centered design. This is something that I helped mentor Design That Matters in before I even joined the organization, and something that a lot of design studios like IDEO, like Continuum, have popularized. The idea around human-centered design is to start with the end user, or in our case, since there's so many stakeholders that need to be satisfied, think about the stakeholders from the very beginning of the process and try to understand the challenges they're facing, and then let that be the inspiration for design. And so in a practical sense, we partner early on with groups like Partners in Health or East Meets West Foundation, who's recently been renamed Thrive Networks, in order to understand things quickly. So with Firefly, we went to Vietnam with Thrive Networks right off the bat. They had a 20-year experience working in Vietnam, providing newborn health care, clean water solutions, education solutions. And so they had relationships at that point with over 180 different hospitals where they were welcoming people to come in and better understand and build off the work that they've done together with East Meets West so far. We also, in order to kind of cross that translation or cultural boundary, we really rely on great translators in multiple ways. There's the aspect of just language translation, but there's also the aspect of cultural translation, because we know when we visit for 1 or 2 weeks and then we come back and use that to create ideas, 1 or 2 weeks is not enough to really understand the complete context of the information that we were exposed to. So then we're able to work with our partner organizations to say, we seem to have seen that the incubators that were donated weren't being used. Does that seem like what was happening as well, given that you've been in those hospitals so many times, you've been there for decades? We're able to then better couch what we saw that way. We also do an iterative process, so we quickly create a lot of prototypes and physical models very early in the process, and then we continue to change them and iterate them. So we have an entire prototype lab at Design That Matters that uses technologies like 3D printing, laser cutting, in order to just drive way down the cost of visualizing the ideas so that we can bring them quickly to people to get feedback. So our newest program is Pelican, which is a pulse oximeter which shows oxygen in blood, and it does it also non-invasively by shining a light through the foot of a newborn. And this technology is targeted towards tackling newborn pneumonia. Amazingly enough, pneumonia is a leading killer of newborns worldwide, of children even. And one of the missing links, they're antibiotics, there's sometimes oxygen, but diagnosing it is very, very difficult. So we want to put a tool in the hands of clinical health workers and also nurses and doctors in the hospitals that they can quickly use to check the oxygen level in different newborns in order to connect the newborn with the treatment they need to avoid death and disability. So we recently made quick models. We're at the very beginning of that project, and we just got back from a trip to Haiti with Partners in Health, where we also were benefiting from that partnership, their extended experience in Haiti, as well as the ability to connect directly with nurses, doctors, clinical health workers who are going to be using the device in the end. And we were able to find out a lot of great insights very quickly.
Thank you, Elizabeth. And Carter, how can innovators avoid doing harm to communities, and how can students and professionals avoid innovating for the sake of innovation?
Thanks, Jennifer. I think the answer to this question actually goes back to a lot of what Heather was saying toward the end of her discussion. And I think it really comes back to designing innovation for the end users and not necessarily getting stuck in the game of trying to figure out which projects and which grants and which contracts to really drive the organization forward internally. Really, what we tend to focus on is really trying to prove the value to the end user of our technology and the end user who's actually the one who's providing the innovation. So we focus on what we call design under the mango tree, which is sort of the opposite of the parachute example that Heather gave, where we try to make sure that our engineers and our team members are interacting directly with the end users of our technology, which most of the time is community healthcare workers. And we're primarily trying to make sure that technology is actually adding value to them and improving the quality of the service delivery that they're doing. And then as a secondary component, we make sure we can get the aggregated reports and the data at the organizational level. So I think our approach is really to design for who is the users of the innovation and really to focus on design under the mango tree approach.
Excellent. Thank you, Carter. And Jordan, how does your organization apply monitoring and evaluation to its work in order to ensure responsible and effective programs?
Well, I think there's really two levels to it. In the case of Ubuntu Education Fund, it's a truly intense model, and as I've said before, a very in-depth model. And the key to something like this is to actually track every step of the way. So when a a young person comes into Ubuntu, they get what we would look at as sort of a client file. And every single intervention that is done with this young person is tracked. And then what we have is something called a family support specialist. So this is somebody on our staff who is specifically assigned to understand this person's life inside and out. And the monitoring then makes up a full story of the potential issues in the child and the family's life, and also the possible solutions. So by tracking the intervention and then by clearly explaining and giving the beneficiary an understanding of the services provided as well, it helps for people to actually take control of this behavior change that I was discussing in my previous answer. And that's really on a micro level of looking at the day-to-day monitoring, the tracking of what goes on and the uses of it on a kind of a daily basis. And then the importance is then to have a bit of a macro picture as well. So taking the data that is entered when we track every single intervention and feeding it up into sort of an equation that we've come up with to look at indicators of success. So when we look at a child's life, and I've heard a few of the participants talk about models that are comprehensive, and that's really something that I'm very much in favor of. When you look at a model that provides one service or another, sometimes you're not able to understand if there are other factors in a child or a family's life that are causing that intervention to fall short. So we certainly believe in a comprehensive model, and we look at the indicators of somebody's health, the indicators of somebody's education or academic success, the indicators of psychosocial support. So, for example, when you're looking at health, of course, you can look at everything from WHO indicators to other basic health statistics that can help you judge whether somebody's becoming healthier. Obviously, academics, we all know how to measure that. Psychosocial support would be indicators from a counselor or a mental health professional. And then taking that all and trying to combine it into one equation to see if somebody is becoming what we would look at as on track. So many different issues in your life could cause you to be what we would call off track. And then adding together the variety of interventions and the results of those interventions to take kind of a holistic look at a person and understand if we are making progress, and then to bring that up to even a higher level and take percentages of whether or not the model is actually working. And if we do that and we do it consistently and we take the time, which is often difficult, and the resources to do that, we can then see if we are truly having an impact on people's lives. And that type of thing has been very effective in us understanding our impact and really seeing where we are as an organization are sometimes off track or on track.
Wonderful. Thank you so much. And Andrew, in your idea development process, how did you gather information and who did you meet to get their feedback? How long was that process and what helped you stay focused throughout?
Yeah, so I actually think that this is the most critical part of business planning, and GHC would be very, very different if we hadn't, it may not even exist if we hadn't, I think, spent a lot of attention to the feedback process. As a quick example, we got our partnership model I mentioned earlier that Global Health Corps has 2 fellows in every placement, one from the local community or a little bit broader than that, and one from another country. And that really came from an advisor of ours, Geeta Rao Gupta, who's now at UNICEF. And we sat down and kind of placed our business plan on the table and said, please tell us, how are we going to fail? How can we make this stronger? And she challenged us to essentially come up with this idea. And without that part of our model, I don't know how successful we would be. One of my recommendations is talk with as many people as possible. I'm a big believer of getting alternate perspectives. Talk to people who've been in the industry or tangential industry for 40 years. Talk with people who are new. Personally, at GHC, we were pretty young when I think the oldest of our 6 founders was 25 when we founded the organization, or 26 maybe. So for us, we had to approach it in a very humble way and say, listen, we know we're young. We think we have a good idea here. Please, help us work on this and make sure this is better. We also invited some of our advisors really closely into the planning process. So I was, literally whiteboarding with somebody at Google.org that had a couple decades of experience doing youth development, and specifically in the global health area. I would also say, don't be afraid to scrap your model if it is redundant. And this came up earlier. I think it was James that brought this up. But we made a pledge. We had a sort of a planning retreat, and at the end of it, we all made a pledge. We were going to do additional research, and if this model already existed with the same mission, we were going to scrap it, and we were going to try and help and consult that organization if it made sense, if we could, and share what we had done up to that point. Through 6 months of research and planning, we figured out that it really hadn't, and we had a unique idea here that nobody had executed on, so we decided to move forward. This process is also really important because you're building advocates for your idea that can be your go-to as you move forward and iterate. I would also say that something else happened during our socialization process, as I now call this, which is really interesting. You tend to get sort of a macro view on how the greater community understands your project. And one interesting thing is we, never had anyone tell us not to execute on our idea. Of the probably close to 100 conversations that I had with people, formal conversations with people, every single person said yes. And when we all kind of put our heads together and realized that we were getting all yeses and no nos, I think that's a pretty good indication you should move forward. And the last thing I would say on this is continue the information gathering and socialization, getting feedback through your pilot program, through your demonstration project, through your beta launch, whatever that is that you're doing. Make sure you're building an environment where you can iterate on the fly. As Rich mentioned earlier, from Echoing Green, the business plan in 12 months is probably going to look different than it is right now. So build an environment where you can take it to the place it needs to be in 12 months. For us at Global Health Corps, that meant being extremely thoughtful for the fellows that we selected. We selected fellows in our network that we trusted to give us quality feedback in an ongoing way. We selected partners that we really trusted and knew and had good relationships with that would give us honest feedback as the year was going on, so we could iterate and make year 2 stronger. So those are my thoughts on that process.
Thank you so much for your insight, Andrew. And for our last question for Rich, what are some of the most common mistakes that you see that are made in innovating for social impact?
I thought about this question a lot, and there are so many mistakes. But I think it's important to also understand that at least where we know a little bit at Echoing Green is about the early stage. And for us, the point of the beginning of any venture is to be making mistakes, but learning from mistakes. So I really just want to focus on one particular perspective that I wound up having a lot of conversations with our Echoing Green fellows about, and it's this concept of powerful vulnerability. And this was actually something that was first described to me by an Echoing Green fellow from the class of 1991, a woman named Vanessa Kirsch. And it's related to that concept I mentioned earlier of resource magnetism. What does it take to help to bring other people on board onto your team and be working with you to support your overall vision? And one thing that a lot of particularly high-achieving young people or emerging leaders really struggle with in terms of thinking about building a new venture is how to walk the line of this thing called powerful vulnerability. And what I mean is as follows. It's often really important when you're trying to demonstrate somebody to write you a check or become your partner in something, or volunteer with your organization. You want to demonstrate that you have your act together, that you know what you're doing, that you're quite competent, that you have what it takes to be a good partner and to be an ally. So you often want to focus on demonstrating your power in those situations. But as it turns out in the social sector, if you come across as too powerful, as if you have all the answers, you've got it together, you don't need any help, then you actually often wind up closing doors to people who really want to work with you because they actually want their contribution to be useful and felt. So it's important to also demonstrate your vulnerability, to send the message that I may be talented, I may have my act together, but the truth is, without your support, I can't actually do this work. And without your help, we can't do this. On the other hand, you can have a social entrepreneur who overdoes the vulnerability, who might walk into a meeting and everything's falling apart and please help me, the situation is a mess. And so you really have to think in every context, and sometimes the line is different for different conversations and different relationships. So you might literally give a minute or two of thought to where on the line of powerful vulnerability you want to be before any conversation or presentation or interaction with another person. But we often find that one of the most common mistakes is either overdoing the power or overdoing the vulnerability and not being thoughtful about how to walk that very important and careful line.
Wonderful. Thank you so much to all of our phenomenal panelists and for all of your expertise and insight that you have shared with our audience today. Thank you.
Thank you, Jennifer. This has been fun.
Thank you, Jennifer.
Thank you.
Jennifer.
Thank you so much. And thank you to our audience as well for your excellent questions. Have a good rest of the evening.